used in the healthcare system. Some of you probably went to a doctor's appointment and the doctor or the nurse is asking questions and they're pretty much just like looking at a screen the whole time and check marking boxes about what you're saying. They aren't really giving you a lot of eye contact. That's just kind of the reality of the hospital world right now. And this is online charting. In online charting, the doctors and the nurses are taking a laptop, computer, iPad around with them into the rooms, and they're sitting down, asking you the questions, and all your health records are on that online charting system. And it's great and it's nice, it's easy, you can get onto it fine, but it's not really giving you the full spectrum of the patient's needs and care options. In an article that Brandon wrote in 2015, he said the system doesn't think like a nurse, indicating that a computer system doesn't have the capacity to make quick decisions like a nurse would or a doctor would in certain situations. Another form of technology in the hospital setting is doctors and nurses having their personal devices on them. A lot of the time they'll use this as like a torch or a light to see into the nose, the ears, the mouth, the eyes, or they can use it to confirm with other doctors about your healthcare needs, ask them questions throughout the hospital, get answers back quickly. I found a survey that took into account patients' opinions about doctors using their personal devices, and 73% said that it was fine as long as it was medically, like it was only for medical purposes. But then 25% said that they really did not like that because they felt that the doctor was just looking at a screen the whole time instead of looking at them. They didn't feel like they were a person in that room. It was just the doctor and the computer. And although most patients didn't mind the technology present, it does pose some problems, such as the distraction for professionals. In the checkup room, it's really just another screen in between you and the doctor. But in a place more serious, as in like a surgery room, it's obviously a huge distraction. You don't really want a doctor being distracted with a phone call that they might be getting. They obviously won't pick up, but just having that like ringing distracts them. And you don't really want like a doctor with a scalpel like cutting into you, getting distracted by a phone call that could end up with that. But it also, there's no connection between caregiver and care receiver. I did an interview with my mom, who was a OB nurse for 25 years, and then she's now a director in a hospital for the inpatient outpatient services. She's been doing that for 10 years, and she has done anything from paper charting to online charting, and she said that there's some drawbacks, but there's also some positive things about it. There's no eye contact, hardly ever, like I've said, and it's way less descriptive because you are just checking boxes. They may type in stuff every once in a while, but in reality, it's not as descriptive as it could be. In this area of the hospital, technology really isn't that great, but in other areas, it's really effective, such as in cardiac surgeries, which are more accurate and take less time if they're robot assisted, such as in this picture, and even though it's huge, they really do a lot better job. And then in a more obvious way, technology being used by patients in their post-op surgeries really improves mental and emotional wellness, especially for kids, because they are more connected to their family, their friends, and if they're missing school, they can keep up with their schoolwork, and that just really boosts their mental and emotional wellness. And then another thing, less room for human error when there's technology being used, especially in pharmacies, because computers are being used to count up the prescriptions instead of the humans. Technology is very beneficial in this area of the hospital. However, I believe that it can be improved, especially in other areas. My main focus was on the online charting system, and I think that can be improved a lot to fit nurses and patients' needs. I don't think that you should just be checking a box. I think you should be extremely descriptive with what you're saying because you want to give your patient the best care possible. In order to do this, I think you should decrease the technology that is in the room with the patient, especially between the patient and the nurse or the doctor, and just make that a lot more efficient by being more descriptive and maybe having more technology outside of the room instead of inside. If this proposal was implemented, then our nurses and doctors could have a better relationship with their caregiver, and I think that would give them the optimal care that they need. And I encourage anybody in the health professions to stop staring at your screen and start looking at your patient, so that way you can human